Our goal for you is to give you the tools, the understanding, the education, and the hope that you can get better. And when I say hope, you need to understand that you can get better. Many people have lost hope, have no hope, tried everything, didn't get better. We have a way out. So part of what I want to do is give you the tools. Like this video, subscribe to my channel, share this information, hit the little bell icon, and add comments. We need to get this information out, and you need to help me get this information out because people are suffering. But I want to give you the tools. What exercises to do, what not to do, why it works, why it doesn't work for some people, who you are, where you're at, and what you need to do to get better. It's not, we've been doing this a long time. We've developed a process. But one of the things that happens, I see it a lot, is patients say, oh, mine's different. Mine's herniated. My herniation's big. I had surgery. I didn't get better. My problem's bad. I've been suffering for a long time. I didn't get better. I've tried everything. I didn't get better. Okay, I understand that. But there's a reason. I'm going to talk a little bit about what that is. But in the end, what we know is compressive loads on the spine from posture and movement habits and instability cause a breakdown to the disc. We did a study with 5,000 MRIs where we did weight-bearing MRIs and had them move. And we saw certain vertebrae weren't moving the way they should, and it made the herniations worse. So we've developed a process around this problem that we've identified that helps eliminate even the worst back pain. But people get hung up in what it's called. It's called stenosis. It's called arthritis. My doctor told me I'm never going to get better. Okay, it doesn't matter. That's the part. That's the tool today I'm trying to give you is it doesn't matter what they called it or who did it. The disc under load, the disc is like a jelly donut. Inside the disc there's a jelly. Outside the disc there's an annulus. Under load and abnormal movement patterns, and certainly part of our sedentary lifestyle where we're sitting way too much, the disc starts to break down. And that breakdown process will cause inflammation, which causes pain, but also cause the annulus to tear a little bit from the inside out or sometimes from the outside in. But what happens beginning phase is the disc bulges a little bit, pushes out a little bit, and then it starts to herniate where it pushes out even a little bit further. And sometimes what will happen is it'll tear all the way through to the outside. We call that a rupture. But if you've had it for a long time, this disc starts to wear out. You start to get a little degenerated disc. Or you develop a little arthritis on the back end of the vertebrae. The arthritis is the breakdown of the joint. Okay, so what have we called it? We've called it a herniation. We've called it a bulge. Well, all these things start to pinch on those nerves, which then cause the pain that goes down the leg, and they call that sciatica. Oh my goodness, I got sciatica. I got pain down my leg. Well, you have a pinched nerve in your back from the disc or the bone, but it's the same because it comes out of a little opening here called the foramen. So in the end, what we've identified, and I'm going to talk about a study that we did, but it doesn't matter what you call it. It doesn't matter if it's a bulging disc or a herniated disc or a degenerated disc or it's arthritis, stenosis, sciatica, or even failed back surgery syndrome. These are all words that we use to describe the dysfunction in your back or the level of dysfunction. And it doesn't matter what the level is. And it doesn't really matter how big the herniation is. This is my spine. I had a severely degenerated disc. You can see the disc pushed out front and back. So it was herniated, bulging, degenerated, stenosis, sciatica, motor pain. I suffered for 10 years. I suffered for 10 years and I tried everything. And I thought, I'm special. I'm a special guy because I got a special problem and nobody can get me better. I got better. Turns out I wasn't special, but I found a way out, and it's the same way out for you. We've been doing this for 30 years, but the key is to eliminate the cause. What's the cause? Posture, poor movement habits, instability of the spine. Those are the causes. You fix those, you feel better. It alleviates the load on the disc, the inflammation starts to come down, the sensitivity goes away, and the pain goes away, and quite frankly, your back starts to feel good. How about that? Not only does it not hurt, but it feels good. How is that? We've done studies, 8 different studies on what causes back pain and how to get back pain better. We've been featured on several different TV shows because of that, and we treat some Hall of Fame football players and professional golfers, and they got better. We've been published in scientific journals, medical journals, and they're archived with PubMed.gov. It's the government database, but it's also archived with the National Library of Medicine. Now, we did a study, 1,200 patients that were candidates for surgery, meaning they had a condition, the pain was severe enough, and the problem was bad enough, and the leg pain was bad enough that they needed surgery. They went to see a surgeon. The surgeon said, you need surgery. They came to see us. When they came to see us, their back pain was an 8.5. They went through our protocol. They went through our process. They went through our procedures. And by the end of it, their pain was less than 1. Again, every one of these patients was a candidate for surgery, and they had tried other therapies before they came to see us. They went through our program, and they got better. Matter of fact, 25%, I know these numbers are very small, 25% of these patients had surgery, pain came back, or flat out didn't get better or even got worse. Came to see us, they got better. So, my point was, it doesn't matter what they call it. These patients, 516 had herniated discs, 885 had degenerated discs, 921 had bulging discs, 907 had sciatica, 807 had stenosis, 312 had failed back surgery syndrome. This is the one that causes the insurance companies all the money right here, because it's very hard to get them better. They get better. There is a way out. It's not hard. The thing is, you have to do it. And quite frankly, you have to do it every day. But it's not difficult. You just have to do it. It's achievable. It's effective. The only time it doesn't work is when you give up. And you can't give up because it's simple. And it's effective. Just takes a little bit of action. It's a simple process. Every day you do the activity. Okay? As you progress down, the activities become slightly more challenging, but they're only more challenging because they were hard here. Okay? Make them a little bit easier, and then you progress. Every day. It's a step-by-step process. It could not be any easier. It just takes a little bit of effort. Helps you take control of your back. Gives you freedom from pain. And oh yeah, my back feels good. Okay? You start to feel good. You have more energy. And it gives you independence. Sometimes you become dependent on Advil. Sometimes you become independent on opioids, God forbid. Sometimes you become dependent on acupuncture or physical therapy or prolotherapy or chiropractic manipulation or laser. Okay? This process gives you independence because this is what you need: strength, stability, endurance, and posture.